everyone. Welcome back to another episode of Living with Hep B. So my name is Monique, and I'm one of the academic year interns at SF Hep B Free this year. And today we're very excited to have with us Miss Alice Chan, who is a mother and very well-loved community advocate for hepatitis B in the Bay Area, who has a lot of experience dealing with Hep B, particularly through her pregnancy as well as dealing with prenatal care and also post-delivery measures to keep both the parent and the baby healthy. And so, combined with her medical expertise as a nurse as well, there's no doubt that Alice has been a great key player regarding hepatitis B awareness in the Bay Area for decades now. So, hi, Alice, how are you feeling today?
I'm doing well. Thank you, Monique. It's so nice that having me. I appreciate that.
Yeah, thank you for being here today. And so, just to get started, could you tell us a little bit about yourself and such as where you live or what you do?
Well, I live in Sacramento, and I came to U.S. As an exchange student and to pursue a higher education. So by the time I'm here, that I attend, college, to pursue, my degree at that time is nursing. Um, and I have been working, with the kind of like the acute care, and also for the last 25 years, I work for the state, for the in-home waiver program, and doing a lot of outreach, to the Medicaid populations regarding, uh, the home operation and community welfare. And now I'm retired, so kind of like I can put in more time, to do more project with the HPV, foundation and also other communities.
Yeah, that's really great. It was really great that you're able to connect with your community even from such a long time in your career. So you said that you moved here as an exchange student. So where are you from?
I was born and raised in Hong Kong, and by the time I graduated, from high school, I feel like I want to go abroad and further study. And
Hmm.
so, yeah, at that time, kind of like I was lucky enough to be able to come to US and pursue my education.
That's really great. And so, what was it like where you grew up, or how different do you think it is compared to the US now?
Well, I was raised in a very traditional Chinese family, and kind of like talking about illnesses. This is kind of is taboo, and so it's very traditional that they have a lot of kind of like belief
Mhm.
that seeing Western, searching for Western medications, or medicine is the last resource. So anything when we have sickness, it's always come with the kind of like the home remedy or the herbal medication first.
I
And
see.
so, yeah, so there's not much discussion, in the family among my parents and my sibling about any kind of illnesses unless you really feel sick and they
Hmm.
send you, yeah, you need some help. And otherwise, discussions, on any illnesses is definitely very limited.
Hmm. Yeah, I definitely feel like I've heard that that's a very common trend among the older Asian generations. And yeah, I'm glad that's changing with now and with I guess you working in medical as well, kind of helping break the stigma. And so how and when did you find out that you had hepatitis B?
Well, make the long story short is I didn't have any testing for anything, at all, blood testing, until I become first pregnant. And then my obstetrician, decided to do a blood test for the hepatitis B. And then that time I find out I'm a chronic Hep B carrier and I have the HB surface antigen positive. And so that is how I find out. And I was shocked about that I have this virus
Yeah.
because this hepatitis B is an infectious disease. And back home, and I know well that this is a kind of like it can be serious, regarding you have this liver disease. And because really I was so shocked and I was so scared because I'm pregnant, and then with my kind of like the newborn coming,
Mm,
but I was so kind of like feel angry in a way.
mm,
Why I get it.
yeah.
Um, so it was very emotional at that time when I found out I was a chronic carrier.
Oh yeah, definitely. So, I know you said earlier like it's really hard for you to discuss like illnesses like this with your family. So, were you able to like talk about it with them or like how did you guys ha handle this?
Well, once I find out, I kind of talked to my husband,
Mhm.
and at that time, um, he is really accepting what they have diagnosed me. But we both were trying to find out how did I get it, and and also through education, through my obstetrician, my husband was screened for the Hep B and found out he has the Hep B antibody.
Oh.
So that means he was immune from Hep B. And so we both work together to kind of like kind of trying to diminish some fear and kind of emotional stress. And then finally, I'm thinking about, wait a minute. So I learned about it can be through the mother to child transmission.
Mhm.
And then I was thinking about, since I don't think I have any blood transfusion or anything contact with blood, you know, and my husband being is just the antibody.
Mhm.
So, and then I kind of asked my mom privately, and my mom did kind of tell me, yes, she knew that she has hepatitis B,
Mm,
and but she kind of feel like, oh, this is because of the lack of knowledge, and
right.
she doesn't feel like this is significant enough to disclose herself that she is a carrier for the HPV. And when I find out, I maybe probably most likely got it from her.
Mhm.
And at some point, I feel like, Mom,
Mhm.
why didn't you let us know? But I realize it's a taboo to talk about, you know, illnesses, and especially infectious disease.
Yeah.
The stigma of having infectious disease is still very strong. And, so kind of like this is really feel like that you have the sense of rejection and
Mhm.
also isolation from the community if you have the HPV.
Mhm.
So she did not care to really let us know. And also, I was trying to kind of like solicit information from my siblings because I have four brothers.
Right.
And two of them are the chronic carrier for Hep B.
Mhm.
And then my oldest brother died of liver cancer and lung cancer. So
Mhm.
I don't know which is the primary, or either it's metastatic, to liver, or either liver to lung.
Yeah.
And so kind of like give me a wake up call. Yeah, definitely is most likely I got it, kind of passed from my mother to me
Yeah.
and at birth. Yeah, so yeah.
Yeah, I see. Yeah, definitely the stigma of like talking about illnesses is definitely having a lot of consequences till today that are still yet to be seen, and that's why it's very important for anyone that might be watching this episode today that if you have not gotten tested, please go get tested. It is very important. Even if you think that your family might not have hepatitis B or it's never been brought up, it is often something that maybe someone might feel very stigmatized about and maybe has not told you. And so, yes, please go get tested. And so, back to you, Alice. So back when you first found out you had hepatitis B, how were you feeling, and like, what were kind of your main concerns? I know you said with your pregnancy and stuff, as well as how do you think, like, what do you think your family was most worried about as well?
Well, the after we calm down and kind of like strategize, what is the future planning.
Mhm.
The most concerning part at that time is my newborn.
Right.
So how that will eliminate the mother-to-child transmission, the virus passed to my newborn. This is the major concern of my husband and I. So at that time, fortunately, the obstetrician is kind of very kind and provide some detailed, information how to protect, the baby from getting the virus from me. And then he lay out a plan. I was so impressed that he was telling me exactly how he will do, you know, um, before and during delivery, and also after, the baby is born. And so he said, "Okay, Alice, don't worry. I will take this kind of like steps. Like when the baby's born, that definitely he will get the vaccine, the hepatitis B vaccine and immunoglobulin right after delivery. That means, within the 12 hours window.
Mhm.
Then also what he did some eye wash, with the silvadine, right after the baby was born,
Mhm.
because he's talking about maybe the mucosal membrane of the eye maybe easily get infected, by the virus. And then he said after that we will make sure that you schedule appointment with the pediatrician to
Mhm.
follow with the second dose and also the third dose, because this is a 3-dose series for the newborn to complete the hepatitis B vaccine. And then definitely the HB immunoglobulin, this is going to be given to the baby right after birth too, to protect the baby.
I see. It's very interesting to know about like how the preventative measures that we can take with babies. And I definitely think, as you said, it's very important that you have a good communication with your healthcare provider so that you're able to kind of feel more reassured. Definitely because having chronic illness such as Hep B can be a very stressful time. So it's very lucky, and I'm very glad that you had like a good healthcare provider that was able to give you a lot of reassurance about that. And so I know you mentioned that you had some siblings, and so I was just curious whether your siblings had found out that they had hepatitis B before you, or like did they get tested after you found out you had hepatitis B, or how did that happen?
I don't have all the details regarding my sibling because also we don't share our health information. So kind of like this kind of the stigma talking about illness is very profound in the family, all the among all the family members. And so I asked them, what is their status, and then they let me know what is it about, yes or no. And then but definitely that is very kind of traumatizing that my oldest brother died when passed away when he was in his late 40s,
Oh, that's
with
very
the cancer, with the
mm,
liver cancer. So that is something that, but at that time, even though my brother has a liver cancer, is at the end stage,
mm-hmm.
nobody was questioning about, what is it, because he is not a drinker. He does not drink alcohol that much.
Mm-hmm.
and he seems to be healthy. And then not until later on find out he has all the pain in his stomach and with some bleedings, rectally. And then by the time they diagnose him, it's already at the end stage.
Yeah, that really is, it's very sad that like the stigma between family members can often, I think without the stigma, maybe with earlier diagnosis, maybe your siblings could have found better care earlier. But um, I'm glad that you were able to kind of, I guess, stop the cycle and be healthy and where you are still today. And so I guess my other question would be with your baby as well. So after your baby was born, did your baby still have to get tested or like after all these vaccines, like what was the process like to make sure your baby was like safe from hepatitis B?
So that was very great with kind of with my pediatrician.
Hmm.
He tested, my babies in, let's see,
Hmm.
2 years after completed the 3 dose series, and also tested again, I think between 5 to 6 years old, and
Okay.
then sure that there's no detection of any HB surface antigen.
Hmm.
So that was a blessing because I didn't know that the repeated test, is so important to follow up, make sure the vaccine at birth work, for the to stop the transmission. So I'm very pleased, blessed regarding they don't have the virus. So,
Yeah, that's great. That's great to hear. And so, I guess regarding yourself, so regarding your own treatment of your hepatitis B, so what do your doctors say about it and how do you manage it for yourself?
hmm. Okay, so after the baby being taken care regarding all the vaccine,
Mm-hmm.
and then I went to my PCP. Then my PCP look at my result of the hepatitis B screening
Mm-hmm.
and was kind of like telling me about 1 in 4 chronic hepatitis B carrier can have liver cancer eventually. So
Yeah.
I was very kind of desperate to see what I can do to prevent myself as a 25% get the liver cancer.
Yeah.
I start to become very kind of like distressed and scared
Mm-hmm.
because now I have my new babies and I was asking myself, am I going to really to see them, to raise them
Mm-hmm.
to the adulthood? So I, I feel so distressed, at that time. And then finally the doctor was telling me, well, we will keep monitoring your liver status. And so what she did is she kind of like uh, get me for the routine monitoring for the ultrasound of the liver and also for the blood work every 6 months and to a year, to find out how's my liver status, how's my liver function, is there any damage to my liver, what is the HB viral load,
Mm-hmm.
in my system. And then I know at that time I realized that she wasn't totally knowledgeable about
Oh.
the HPV.
Mm-hmm.
And so in some of those sessions I have with her in person, she said, wait, I'll get back to you. Because, to interpret the result and also talking about the follow-up monitoring, it is something that she wasn't totally kind of like have a full knowledge. So,
Mm-hmm.
and then she got back to me, this and that. This is the kind of make sure you are, on the kind of like the monitoring for any progression of your liver.
Mm-hmm.
So, and then I follow through all the routine monitoring for the liver ultrasound, for the blood work every 6 months, and gradually she reduced it to every year, and for many years. And it seems like my HB viral load remains low.
That's
And she said, you don't need any treatment, Alice. So I said, okay. So I just, trust her whatever she was telling me, I don't need any treatment. I just need to have regular monitoring of myself. And then the other thing, what I decided to do, I said, wait a minute, this is something very important to me because I want to still kind of like raise my children,
Mm-hmm.
without contacting or have any kind of like the liver failure, right?
Yeah.
Because of the Hep B. And so, and then I did some research and said, hey, you need to have a good lifestyle change
Mm-hmm.
to accommodate, the deterioration of your liver because your liver is already getting insult, by the virus. So you have to protect your liver in a long term. How to do it? So I kind of like try to eat healthy, uh, and definitely get away from alcohol
Mm-hmm.
and maybe only kind of like some cocktail on occasion in some event. Otherwise, it's no alcohol.
Oh.
And then eat healthy, um, exercise, so do a lot of exercise. And especially my husband and I, we like outdoor, we like hiking and swimming. So
Mm-hmm.
we do a lot of those outdoor exercise. And then when the kids get older, we also, kind of like as a family, we have a lot of outdoor exercise and try to eat healthy. And that's how I feel like, yeah, this is something I can manage myself to
Mm-hmm.
hopefully protect my liver. And hopefully the button of the liver cancer won't turn on to me too early,
Mm-hmm.
before I can see my children, grow up. So that was my wish at that time. I said, I'll have to do something.
Mm-hmm. Yeah, definitely. I think having a healthy lifestyle is just very good in general. Yeah. Just like not even for only Hep B, but for other diseases as well. And just for keeping yourself healthy. And so, I know you mentioned earlier that you said your viral load was very low, and so you didn't have to do treatment. And so I think a lot of people might be wondering, does this mean that you are like cured from Hep B, or do you still have Hep B? Are you still like considered a chronic carrier, or how does that work?
Well, what my understanding is for the hepatitis B, kind of like the viral DNA to test for the viral load. Uh, if your viral load is over 200,000 IU,
Mm-hmm.
that means you meet the threshold to receive hepatitis B, the treatment,
I
the
see.
therapy. So, but if you are below, that means the treatment is not warranted based on the I kind of attend some webinar, some guideline.
Mhm.
Um, but so kind of like it's a great news that last week because I wasn't feeling well, for weeks, and then the doctor decided to repeat some testing for the liver function and also the viral load on me, and then find out that my Hep B viral the DNA
Mhm.
is undetectable.
Yeah,
That
that's
means
great.
I in my blood I don't have the viral kind of like circulating in my blood.
Mm-hmm.
Or and then yesterday when I attend a webinar about the viral infection, and then the doctor was talking about, I kind of paraphrased what the doctor was talking about. The doctor was talking about even though your DNA was undetectable, however, you might still have a little bit amount that is circulating in the blood, but it's not enough to detect, by the testing.
Mm-hmm.
So at least I feel like I'm safe, that to the kind of like the minimum part of it, the DNA wasn't there or is not kind of like high number enough to causing any problem. And then the other great news is my hepatitis B surface antigen is
Mm-hmm.
negative. So it seems like my body clear up, the surface antigen, which causing me, to be a chronic carrier. So I feel like, yay, my kind of like change of lifestyle probably helped me, to overcome it, to clear the surface antigen, out of my body. But I still very cautious that I still had the kind of like the HPV, in my system. So if I have any risk factor to kind of reactivate it, so I think I still would be very cautious
Mhm.
to put myself under the radar of kind of monitoring in a period of time. Make sure. Yeah.
Yeah, I think that's really great. I think your story is definitely a very good example for like a lot of hepatitis B carriers out there that like you can still definitely lead a healthy life and still be pretty healthy even though you might be diagnosed as a Hep B carrier. And yeah, so I guess I'm gonna move on to a little bit of more community-based questions now. So with your work as a nurse, how do you think hepatitis B affect your career and how did maybe your work affect your treatment of hepatitis B?
Okay. I think the well, the hepatitis B as a chronic carrier, I don't think that ever so far affect my career
Mm-hmm.
on my work status. Because as a nurse, if I do the bedside care, I always have protection for myself and also protection for the patient by wearing gloves if I have any kind of like direct contact. And even though by the time, I find out I have hepatitis B and it wasn't an issue for me to work at the hospital or at the clinic or at the state, government. So I feel it's okay for that, And then, but regarding the uh, hepatitis, as far as I feel like the vaccine is the most important things that everybody need to understand because in 1981, the hepatitis B vaccine was discovered, and
Mm-hmm.
then it is getting to have the catch-up program, starting in the mid or in the late 80s, in the to 90s for the catch up for all the newborn born to the HPV mother to have the vaccine, even though it wasn't universal, but it is all recommended. So this vaccine has been in place for a long time and very effective. Like my children, it's kind of like repeat the vaccine is a lifelong protection for them, to get HPV. And then one might understand, when I work, for later on for other programs, for refugee health at the
Mm-hmm.
state level, and then the universal screening of pregnant women of the HPV that came on board that require, all the pregnant women to be screened, by for the HPV. Uh, at the prenatal care. So that was a very great news. Everybody gets screened. But definitely there's some loophole or some kind of like things fell through the crack that I might want to mention later.
Okay, yeah, that's great. I'm really glad to hear that there's like more and more work being done for hepatitis B. And like it's been a long progress, but I definitely think that like what we have in place nowadays compared to like in the 80s is like so much better. And I'm really happy to hear that. And so, once you found out that you did have hepatitis B, like, did you talk about it with your family or friends, or like, how did they react, or like, just were you able to kind of express like your concerns, or maybe just kind of be open about your struggles with them?
Well, it is a good question. Because I was very open to my family, my immediate family,
Mm-hmm.
my husband and the kids, we talk about it. And my kids, learn so much, knowing mom has this chronic disease and how to kind of like destigmatize it and how to protect, everybody being stay healthy. And then, but however, talking about dispose my status to people around me
Mm-hmm.
in my circle of friends, I don't think so. I didn't do that until I can say probably maybe 8 years ago.
Oh, okay.
So yeah, yeah. After I think maybe 6, 7 years ago, after I kind of like participate in the uh, Just Be storytelling the campaign at
Yeah.
the Hepatitis B Foundation.
Mm-hmm.
And I feel like I was in a safe place and welcome place and also a supportive place that I can kind of like unlock myself to let people know I am a chronic Hep B carrier. That
Mm-hmm.
I do care for people around me, to try to kind of like eliminate the transmission, especially, for the with the vaccine, the treatment and the monitoring. And
Mm-hmm.
so you, you can see the profound stigma in myself, even though kind of like I I have been doing some personal community work, like in the Chinese language school,
Mm-hmm.
kind of a decade ago, more than a decade ago, that to educate, the parents about hepatitis B and also mother-to-child transmission and the vaccination and prevention. But I never kind of like tell them I'm a chronic carrier. I never had the gut to tell people until I feel like now it's safe, that uh, I'm not alone. There's a lot of people around me that I need to share the story.
Mm-hmm.
And my story to them is important. So instead of just talking on a third person's, perspective, I
Yeah.
feel like my direct message to them will mean a lot. It's important to them and also to myself.
Yeah, I'm really glad that you were able to feel safe and be open about your identity now. And I definitely think you being a survivor and kind of advocating for Hep B so strong is definitely an inspiration to a lot of people and a big motivation. Do you think that you kind of telling people about your kind of diagnosis has changed people's views of you, or have you kind of experienced any change in attitude after you told people about your diagnosis?
I feel like my honesty, to let them know I am the HPV, person. I
Mm-hmm.
feel like people are more acceptable. And definitely the positive part of it, I don't feel the fear of isolation or rejection, or the belonging to the group. I feel like it's just of like my openness, feel like I'm more acceptable to them. And
Mm-hmm.
also regarding the knowledge I've been advocating, regarding, the HPV, it's more acceptable. I kind of feel that is a good, there's an encouragement for me to continue to educate and advocate, for the HPV prevention and especially the mother to child transmission. And then I can tell you there was I remember vividly about a health fair that I set up a health booth, uh, in one of those celebration events in the Chinese community. And then at that time, uh, when at the booth there, somebody was talking to me, and then someone caught my attention far away.
Mm-hmm.
There was a lady. She looked like pregnant. She was standing about at least maybe kind of like 200 feet from me.
Mm-hmm.
And she's watching what I was doing with, the people attending my booth. And
Mm-hmm.
then after that, when everybody's gone, and I'm the only one at the booth, she walked kind of close to me
Mm-hmm.
and then approached me quietly and kind of like telling me I need to know more about the mother to child transmission
Mm-hmm.
or hepatitis B. Well, she was talking to me in Chinese. Okay.
Okay.
So one thing is it's kind of like she know I can speak her language. It's more kind of like sensible, to her
Yeah.
need. And then by the time, and then I asked her, are you going to have a baby soon? She told me yes. But she said, I'm scared
Mm-hmm.
and I don't really share with anybody. Uh, and I know myself have the hepatitis B, the HBV.
Hmm.
So, and I give her whatever information I have. So that is really a kind of like the moment I feel like, yes, I did something. That at
Mm.
least this lady was kind of like solicit information from me, and I was able to give her whatever I have to reassure her that will be safe. The baby will be well taken care. Hopefully by your obstetrician and the pediatrician, and also regarding the knowledge she has. Because a lot of time the stigma can be heightened by insufficient knowledge.
Yeah.
So by the time she has the knowledge, she's empowered with the information she needs to know, she will, I hope, probably will be more open and then, find out more how to take care of herself and the baby. And so that is a kind of like a lesson that I learned. I need to continue this endeavor of the mother-to-child transmission elimination to outreach to the community and the local public more often. So that was a very rewarding experience and really stood out so far.
Yeah, I think it's really great that you mentioned that she was Chinese speaking. I definitely think that like because hepatitis B is so prevalent, especially among Asian people, I think it's really, really great that you're doing outreach in Chinese because I know like the language barrier can also be something that makes I guess people very stressed about going to the doctors or just being afraid to kind of ask for more information. But because of people like you, who are able to give information in Chinese, I definitely think that is very helpful, such as in the case with the mother where you were able to help her personally. And yeah, so I guess with these mothers, perinatal screening for hepatitis B is now standard after the mid 1990s, as well as the hepatitis B vaccine being standard for all infants. And I think that's a very, very good progress that's been made since, the hepatitis B vaccine has been developed. And so, what more do you think needs to be done in regards to protecting infants against HPV?
Well, I think to receive the vaccine in a timely manner is very important.
Hmm.
So I know that for the healthcare provider right now, there's a lot of increased number of home births that
Hmm.
family decided to do the home birth instead of go to the hospital. And that might be a loophole regarding the vaccine at birth, given on a timely manner. And I have an experience with a couple of the pregnant lady who
Hmm.
use a doula to kind of like a trained person who guide them through the prenatal delivery and also postpartum. And and then, regarding the vaccine and immunoglobulin given within the 12 hours or 24 hours, depends on its HPV status of the woman. And so it is kind of like still lack off. And so because the doula, they don't give the injection, on site when they deliver the baby. And then that means the mom has to be connected, make appointment with the pediatrician after the childbirth and to get the child vaccinated. So that is one of the concern when I was made aware about kind of like this kind of practice in the community because uh, to prevent mother to child infection is the transmission is right now still globally a
Hmm.
lead of the HPV, transmission. So I think that's important to address some of those kind of like the loophole that what we see to correct it and make it work better. Yeah. So
Yeah, I think that's definitely worth considering. I think that's something that definitely a lot of people would not think of if they're thinking about home birth. But yeah, you bringing this to light is very important, and I think like definitely doula should probably be more trained in like kind of hepatitis B awareness, especially because as you said, the time gap is like so sensitive and it's such a small little time gap that a lot of mothers might forget about in the midst of everything else. And so, yeah. So, how do you feel about the continuum of care for people that are infected, or like how important is it, and like what should they kind of pay attention to?
Yeah, it's a very good question. I think I do emphasize on the kind of like the continuum of care, kind of after delivery
Mhm,
and for the navigation of the services. Uh, as far as I know that kind of like some some family do have a gap, in the insurance coverage.
mhm,
Um, when I work in the healthcare system, because a lot of time the pregnancy coverage is only for a limited term, and then after that, uh, they are not covered for any kind of like healthcare services. There might be a gap, for the vaccination access and the monitoring of the mom and also the testing of their household members. So that's important. Hopefully, um, the healthcare provider will take a look at what kind of insurance coverage they have to avoid any gap that to kind of diminish the compliance of the follow up. And so uh, and one thing I like to also suggest, regarding the continuum of care,
mhm,
that it provide the patient with some sensible approach. What I
mhm,
meant sensible approach is kind of use the kind of like the medical assistant or the CNA or the community health worker,
mhm,
to kind of triage or give some orientation to the patient uh, about HPV.
mhm,
And I think they they have a very important and valuable role for those medical assistant or the kind of like the community health worker to kind of triage the patient, by
mhm,
the time at the clinic setting, because they have a little bit more time to talk to the patient. And also sometimes, that they might be able to speak their language, to kind of like to provide, some trust, that find out what is their HPV status and what is their idea, their knowledge base to kind of pursue the testing, the vaccine, and the follow up and the treatment later. And then one of the things that I was impressed, regarding a few weeks ago when I was at the doctor's office, the
mhm,
medical assistant kind of like checked my blood pressure. And
mhm,
suddenly my blood pressure jumped skyrocketing
mhm,
was skyrocketing. I don't know what's the reason, right? And
mhm,
then the next thing, she was kind of do some kind of assessment, this and that, and then repeat and repeat.
mhm,
After that, she said, Alice, I'm going to schedule you to come back in
mhm,
4 weeks to recheck your blood pressure, make sure you're okay. So you see how powerful it is as a
yeah,
patient, because the doctor is always so busy and so many things they have to take care, right? And so by the time the medical assistant they triage you or they screen you, they say, okay, this is something that we'll take care of it. Now you come back or you call me, within that
mhm,
time frame. So I think that is very kind of like important. If you use the community health worker, the frontline people, they are a very valuable resource, can be able to kind of detect more stuff, or either guide the patient in a way to navigate them to the right direction. I think that's very good.
yeah, I definitely think that frontline healthcare workers are very, very important. As you mentioned again earlier, speaking the same language as the patient definitely also plays a really big role. I think often a lot of patients, especially those whose English is not their first language, they might feel very nervous or very stressed about kind of seeing healthcare professionals. And I think these people who like aren't necessarily the doctors, but everyone else that they might see, maybe just a small step in like speaking their language or just being more friendly definitely goes a long way in like helping people who might be sick or might need to find treatment to be more open or receptive to kind of finding this care. So yeah, I think it's very, very important as well. And so in that kind of the same vein, how do you think we can best educate others around us, or how we can educate our community in general about hepatitis B?
What I see is since hepatitis B still has a lot of has stigma, very strong stigma attached to it, and I see even though for everything so far that I have done, there's still room to improve and room to get to an open dialogue, frequent conversation, with the HPV, and sharing the knowledge is very important to the community in their cultural and also language appropriate way.
Mm-hmm.
Uh, then raise the awareness, to the community in a different setting. So not only at the clinic setting or the healthcare setting, but in different events that can kind of like champion, to attract, different audience, but able to spread the word, to make it is like a kind of like a common kind of theme, to discuss like diabetes, hypertension, heart disease, stroke, right? And
Mm-hmm.
so also the other thing is I think words matters.
Yeah.
So whoever you deal with, regarding when they have question or when you're promoting, the campaign, and sometimes whatever you say can drive people away from the testing and screening
Mm-hmm.
because they want to sense a positivity to that, not a kind of like a death sentence or something scare them away. So I think the worst is matter, to the audience, to whoever you talk to about how accurate this is the fact, and then but there is all this solution, all this support system in place that can keep you healthy and keep you guide you to the right way. It is nothing that will kind of like eliminate you, for your diagnosis being positive. And
Mm-hmm.
the other thing I can say is the health professional, they need to be more knowledgeable about HPV
Yeah.
as some other kind of chronic disease, like stroke, diabetes, and hypertension.
Yeah. Yeah, I definitely agree. I think that it's very important, as you said, like I think for a lot of healthcare providers, there's still kind of that gap because a lot of, in my personal experience talking to people like about hepatitis B, a lot of their doctors often like don't tell them about hepatitis B, or they kind of just don't know about it at all, even though doctors are kind of mandated to tell their patients about this risk or get them tested. So I think there's definitely a long ways to go in that regard. And yeah, I think as you also mentioned, like it's very, very important to let people know that hepatitis B can be very life-threatening or very dangerous if left untreated or if you don't know that you have it. But at the same time, it is also very treatable and, very manageable with kind of preventing it with a vaccine or just kind of through medication. And there's definitely a very fine line, and it's very important to kind of therefore approach them with positivity and kind of support to make sure that people are open and receptive to kind of getting that treatment. And so, with almost your like decade long of experience with outreach and advocating for Hep B awareness, what are some things that you might do differently now versus like if you could go back and do things differently or tell yourself something, what would you do or say?
Okay, so I think I would say, oh, to to test for HPV sometimes can be kind of scary
Mm-hmm.
if people not aware about, don't have enough knowledge about HPV.
Yeah.
Because one thing I can say is in the COVID time, when we
Mm-hmm.
did some survey on the COVID, plus some HPV knowledge and their status, and a few people was talking about, oh, I was tested for HPV, you
Right.
know, but I'm scared to follow up with the result. I say,
Mm-hmm.
why? Because he said, if I find out I'm positive, oh, I don't know what to do. I will
Right.
be scared. So that means, that reflect and telling me the message is, they don't have enough knowledge to know about or what will be going on by the time you tested, positive.
Yeah.
So it should not be kind of like scare them away to get tested because, or they already tested, but they scared to find out the results. So there's no follow up at all. And maybe a provider is too busy to kind of like to follow up. And I think the what I learned from them is it's important to give them as much education as possible about the treatment, the monitoring, the vaccine. Everything is here. It's not any kind of like the high level you have to achieve in a high stake. And then as a provider, definitely the follow up is needed and also give them as much information as they are by the time you provide, the testing. And especially right now, you with the universal testing for all adults,
Mhm.
that HBS San Francisco Free, has kind of put all this effort
Yeah.
to really make the dream, you know, came true in 2022, right? So
Yeah.
universal adult, screening is there. So nobody should be fear about the testing for the negative if they have a full knowledge what's going on after that, how you handle it. And also have somebody to guide them, to navigate them, through the system. I think that's important.
Yeah, I'm definitely really glad that SF Happy Free has been able to kind of help with this outreach efforts. And so right now, if anyone watching might have either just found out that they have hepatitis B or is worried about having it, what would you say to them?
Well, I will tell them that it's very hopeful that you will get care, right away, even though you find out you have the screening show you positive. Like myself, you can manage it on your own. If your rival load is kind of low, and if you don't have any symptoms, because most of the time when you are chronic carrier, you are asymptomatic. You won't show off any illness. But however, you can do things to protect yourself, uh, and like, change your lifestyle to be alcohol, abstain from alcohol or limited alcohol consumption, healthy eating habit, and practice gratitude on a daily basis. That thankful for everything you have, and make sure you still live life to your fullness, and will be less stress. And I think it's manageable. And then follow up with the routine monitoring advised by your doctor, and if you are positive, and there is definitely a lot of support, from your healthcare providers, regarding what to follow through if the treatment is warranted, under the guideline. And also, right now with a lot of community-based organization like the Hepatitis B Foundation and SF, Happy Free, and those all this organization is very reliable and real credible that you can count on and to get support. So, and also there's many people around you, that you can kind of reach out, to get their support. So right now with all the resources available, this is the thing being kind of like in the vacuum that you will be lack of.
Yeah, I definitely agree with you. And so if I know you had a lot of experience with like your relatives kind of having to deal with hepatitis B, but if say like right now you found out that someone that you're related to or someone is close to you has just gotten Hep B, what do you think you would do or like how would you deal with that?
Well, I will guide them, as to navigate through all the stages,
Mhm.
make sure that they are protected, follow through the guideline, and also their people around them, their family, household, get kind of tested and vaccinated
Mhm.
to protect everybody. And then the other thing is, I feel like this is important to kind of like give them a lot of positive feedback and guidance, how to navigate through the healthcare system because it can be very complicated.
Mhm.
And hopefully, right now, the coverage for the monitoring and also the treatment is not a major issue as decades ago, and it should be getting easier for all the. It doesn't require specialists to follow up with you unless you have kind of like the major um, uh, consequence of the liver failure, and otherwise they can still live a healthy life and do whatever they want to do. And so, as far as the change in their lifestyle, this is very important.
Yeah, I agree. I definitely think lifestyle changes can go a long way, and positive support of people around you is definitely very, very important in such a stressful time. And so, with that, I'm kind of wrapping up with all the questions I have for you today. And so, what else should people watching this video know, or is there anything else you want to share or talk about?
Yeah. So, kind of, I think the more I dealt with, different organizations,
Mm-hmm.
and I feel like that really opened door for me, to outreach to a broader uh, populations
Mm-hmm.
that I did not anticipate that will happen. And especially, I want to say, kind of like, uh, appreciate, some of the organization, the academic or either the community organization that has supported me. Uh, Earlier I mentioned about the Chinese language school. That was my initial outreach, to protect, the childbearing age women, from transmission, perinatal transmission. So the Wisdom Language School in Sacramento. And then the other thing is also I want to uh, appreciate Dr. Samso, um, who initiated the J Ribbon campaign because at that time when I was doing the outreach to the community at a personal level, I did kind of like hook up with them for the J Ribbon campaign and also spread the messages to the local community in Sacramento. So that they're very grateful to know that as my son connect me to them when he was a student at Stanford University for the Asian Liver Center, for the JRIP campaign. So that was grateful. Yeah, I can do that. And the other thing I also want to thank you, Dr. Moon Chan, who is a professor at the UC Davis Cancer Center, was able to give me opportunity, to educate the local Asian community, the Vietnamese, the Hmong community about hepatitis B prevention and elimination. And then also most importantly, we up to the Hepatitis B Foundation uh, with Dr. Sherry Cohen, the president of the Hep B Foundation, who really offered me, and raised my kind of like horizon to educate a much, enlarge the outreach, to the nationwide community and also even though a global one, for the journalists, from overseas. So really appreciate that. And the other thing is on the San Francisco Happy Free. Definitely I thank you so much, for the opportunity to amplify my personal story and invite me to be on board, for this section. I thank you so much. So I can say from the bottom of my heart, I appreciate all the support provided to embrace and enrich my journey as a community volunteer, to eliminate hepatitis B through the mother-to-child transmission and also to reduce the liver cancer in the next near future journey. Thank you.
Yeah, thank you so much for sharing your story with us today. I definitely think that you just sharing your story like this and like just sharing with us today is definitely very uplifting, very motivational, and can serve as a very good example for a lot of people that might also be in very similar situation as you, where they might also want to have kids maybe, but are afraid of kind of transmitting it. And I definitely think that your work and your outreach has gone a very, very long way in helping a lot of people in our community, particularly with this Chinese speaking community. So I'm really glad that you were able to share your story with us today. And yeah, thank you again just for being here. And yeah, I'm thinking, so that's about it from me today. And yeah, so thank you so much. And I hope you have a great day.
Thank you, Monique. It's a pleasure to meet you and talk to you.
Yeah, thank you. I had so much fun as well.